The following is a community analysis of Gulfport. Gulfport was originally known as Diston City in the late 1880s. It has been an established city for over a century. Many were drawn to this sleepy beach town for its proximity to the water and still are to this day. In 1904, they hoped to entice Civil War veterans to the area and renamed it Veteran City. When the city didn't gain popularity by the veterans, they renamed it Gulfport in 1910 and marketed as the gateway to the Gulf. Gulfport is known for its marinas, casinos, and beaches, bringing a large tourist population. Today, the city remains a fishing community with a vibrant downtown area full of art, culture, restaurants, and shops. Some of the key people who helped develop Gulfport were James and Rebecca Barnett, who were the first settlers. Joseph Torres came in 1876 with money and the ambition to grow the area and created the first merchant store. William Miranda Vincent Leonardi was one of the first builders, and John F. Chase was responsible for renaming the area Veteran City. Within Gulfport, you get the small town living experience. There are many schools, parks, and businesses. When assessing the community, I found they have their own police department, fire station, public transportation, a local library, and even a community center for senior citizens. There are many fruit and vegetable stands and small convenience stores, but for a large grocery store chain, you would have to travel just outside Gulfport to find one. There are doctors' offices and pharmacies within Gulfport, but for walk-in clinics and hospitals, again, you would have to travel outside of Gulfport. Overall, it does appear that the community is meeting the needs of its citizens, and the things that are missing are located in the neighboring city. In my research, I found that pneumonia affects about 650 people annually in Gulfport. Populations age 65 and older are at the greatest risk of suffering morbidity from pneumonia. With 25% of the Gulfport community being 65 and older, this is a definite health concern for the community. Research shows that only 61.3% of this population get immunized against pneumonia, and the CDC advocates raising this number to 90%. Gulfport is a small city, so some resources are not located within the city. St. Pete is a larger city surrounding Gulfport that has many resources available that Gulfport residents can utilize. There is even a free clinic located in St. Pete that is only a few miles away from Gulfport. Gulfport does have its own rehab center within the community called Gulfport Rehabilitation Center. The Gulfport Senior Center does offer events and support groups to assist community with health and wellness. Healthy People 2020 creates national objectives every 10 years to improve the health of all Americans. I chose three goals from their list that I felt were most relevant for my chosen community, focusing on immunizations, healthy weights, and healthy sexual behaviors. The first area of focus is increase immunization rates and reduce preventable diseases. Children and elderly are at a higher risk for contracting preventable diseases. Gulfport's population is 25% over 65 and 14 under the age of 17. With a large part of their population at risk, I chose this as one of the areas of importance for my community. Next area of focus is to promote health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights. In 2010, a survey showed that 65.9% of the Pinellas County adults were considered to be overweight or obese. Obesity leads to many chronic diseases such as heart disease, diabetes, osteoporosis, and even some cancers. Education and resources are needed to assist reduction and prevention of obesity. With such a large population being obese, this is an important objective for the Gulfport community. The last area I chose to focus on is promotion of healthy sexual behaviors, strengthen of community capacity, and increase access to quality services to prevent sexually transmitted disease and their complications. Pinellas County's top communicable diseases included chlamydia, gonorrhea, and syphilis. There is a need for education resources to assist this area to reduce their STD rates. As I mentioned, Gulfport is a smaller community with limited resources. Water, sewer, and trash is maintained by either the city or the county. With no major hospitals in the area, within the city, and EMS spread throughout the county, response times may be longer. And shelters for the homeless and for emergency evacuations, one would have to travel into St. Pete for these resources. The community of Gulfport is responsible for electing their mayor and district leaders. These members have phone numbers and email addresses listed on the Gulfport homepage for people to contact them. Many concerns made by the community are addressed at city council meetings held twice a month. Many people expressed concern at a recent city council meeting that they felt that they were being overcharged for their water use. They spoke about trying to find assistance for those feeling overwhelmed by their utility costs. As I did my community assessment, there were a few areas that I recognized were missing or needing improvement. I mentioned earlier that obesity was the issue within Pinellas County, and education resources are definitely needed to assist the community. I also learned that the community has been raising the issue of high water bills at the city council meetings, and some were concerned that those on fixed income would struggle to afford these costs. I noticed that there are no walk-in clinics or hospitals within the area and very few doctors' offices. Many of the residents would have to travel outside of Gulfport for their primary care, which may be a deterrent for them. I think the community could use more education about the importance of vaccines, regardless if it's for children or adults, to help prevent communicable diseases. I noticed that there are no homeless shelters or resources within the community other than what the local churches had to offer. This puts a strain on resources outside of the city. They may have to provide assistance to communities other than their own. Lastly, the entire city is located in a flood zone, which puts them at risk during storm season. Many may not have the resources to protect themselves or evacuate during a major storm. This concludes my presentation. Thank you for listening.